Hi there, and thank you for joining Boat's Memory Method. My name is Sira Boats, and I'm here to help you find hope in the dementia journey. And today we bring you an expert from the state of Florida, and I want you to welcome Linda Murphy. She is the COO and co-founder of one of the largest in-home skilled care agencies here in Florida, Concierge Home Care, as well as Mobile Medical. Linda, thank you for joining us, and please introduce yourself a little bit to the audience.
Well, it's an honor, and I feel blessed to be here today to speak on a subject that is intensely personal to myself and the patients that we touch on a day-to-day basis. But my name is Linda Murphy. I'm the co-founder of Concierge Home Care. Saw our first patient in June of 2015, and since that time, we are very fortunate that we've grown across the state of Florida. Today, we're currently touching approximately 15,000 patients on a day-to-day basis between our mobile medical division and our home health division. About a half and half split. So on our home health division, we are typically seeing patients that may have disease processes such as dementia, diabetes, congestive heart failure. We take care of acute care at home patients that have been discharged from the hospital. We take care of patients in whatever home setting that they have, whether it be an ALF, an independent living facility, or in their homes. And we also do provide hospital at home and some other initiatives across the country that CMS has been working on and how we better deliver care.
Very innovative in what you do. Very innovative. Always at the front end of trying to find new solutions for our audience. So, and I know dementia, since this is the dementia channel where we're talking about the dementia journey, I was hoping you could share with our audience a little bit why dementia is so close to your heart.
I would love to. So, as a nurse myself, I spent my first 15 years working as an emergency room nurse and charge nurse in that area. So I really understood how you needed to bring care, even taking that experience into the home health, and how we should be able to do whatever we do in a hospital setting in that home. But when my mom was about 54 years old, she was diagnosed with early onset Alzheimer's. We had started to see symptoms related to that Alzheimer's probably for a few years before that.
Tell me, at this point, were you a nurse already?
I was a nurse already.
So you already had some medical background, whereas some of our audience may not have that. But as a nurse, you were able to see some of those signs and symptoms.
I could, and I was able to recognize them relatively early because I did work with the geriatric population, and we saw a lot of dementia in our current patients. I probably fell into some of the excuses. My mom had breast cancer at an early age and had multiple surgeries and had some chemotherapy for many, many years. So I think a lot of times you were kind of summing up some of the difficulties that she was having related to some of
to some of those factors that will cause cognitive decline.
Yeah.
The chemo, all those anesthesias, repeated anesthesias. And so sometimes it takes a little bit longer to kind of accept that maybe this is beyond just that cognitive impact from the cancer and the anesthesia.
And I'll be honest, I can remember the moment that it really hit me. And we were walking through the mall, and she looked over to me and she says, "I have no idea who you are, but I really like you."
Oh.
And
How did that make you feel in that moment?
Well, love, but even when I think about it, I want to tear up because it was the fact that she was willing to admit that at the last moment. It was shocking to me that when she lost the ability to know who my dad was, she still would confide in me, even though she didn't even know there was a trust a trusting relationship enough as we went through those last few years.
She knew how you made her feel, even though she didn't remember exactly what your role were.
Exactly.
She still had that trust and love, which we say, that's the beauty of dementia. That's the superpower, is that they will keep that emotional bond, if you have a strong emotional bond, and to hold on to that.
Yes.
Yeah, so that's a beautiful story. And then how did you navigate, what got you through that last few years? And can you talk a little bit about how you guys navigated it?
Absolutely. And probably one of the reasons, it was before I even went out on my own to start my home care agency and better understand. I struggled even as a nurse that was working inside of a home health agency and understood some of the resources that are available to help caregivers. But when it's a personal journey, you know, and watching your family members and what everyone along that line goes through, I'll be honest, I made 3 referrals to hospice because I knew we were getting close to the end and we were denied care. And then I can still remember the day when I finally did get hospice in the door, and she sat on the couch while we were talking to the nurse on the other side. And there was a part of me that knew she knew what was happening. So it's, as a caregiver, as a nurse, as someone that's very familiar with taking care of these patients, the dynamics, the pain, the suffering that you go through, and the decisions that you're making, imposed on the relationship of, this is my mom and I'm making decisions for her, and how does that affect her? It's a difficult time for anybody in that situation.
And then the way healthcare is, just having to navigate it as a nurse, you had that little bit of leverage to be able to navigate resources and to understand. But I know for our audience, that's sometimes very challenging, just to navigate the healthcare system and the resources. But that brings us to the hope. And the hope is that you then founded your own home care company and have been instrumental in spearheading solutions for dementia. And therefore, we are partnering, and we are here as partners, dementia partners, with Concierge Home Care being the exclusive home care company that's using Boat's memory method as their preferred dementia platform in order to make a difference. So I want to ask you, from a home care perspective, I guess I'm asking a twofold question. So number one, can you please just kind of tease out for us the resources that somebody can expect from a home care company such as Concierge Home Care? So that's the one part of the question. And then the second part would be, for the person living with dementia, why choose Concierge Home Care? And what puts the Concierge Home Care apart in the dementia arena?
Very good question, Sarah. So a lot of folks don't understand that Medicare actually has a beneficiary payment to teach caregivers how to take care of patients with dementia. Education is a huge portion of what we do from a home health perspective to engage patients and better understand how to take care of their health. Dementia falls right along the lines with that, and specifically the education of the caregivers who are taking care of those patients with dementia. So,
it's covered under Medicare.
It's all covered,
100%
covered. So your Medicare A benefit covers that. If most folks look at their Medicare card, you have A and B. Your A piece is paid 100%. No deductibles,
at
no
home,
co-pays,
in the comfort of your own home,
where you're really going to identify how you can better help a patient with that.
And this is done through different kind of staff members. So you have access to either a nurse or a physical therapist or occupational therapist or a speech pathologist or a social worker, just depending on what your needs are, that then visit your home. And then that's covered 100%, correct?
Correct. And we do a full assessment, head to toe assessment, social, economics assessment, depression, all of those different pieces to identify. Now, to take that a step further, I'd like to say most home care, not every home care agency is the same. So we have invested a tremendous amount of money and education hours thanks to what you deliver to our team members. It's a huge.
You truly believe in education and empowering your staff, and that's the beauty.
Yeah, and we had calculated it's millions of dollars we've spent in additional education around dementia to our caregivers. And when I say our caregivers, our therapists, our nurses, our team members that are delivering that care. But there's a lot to be said when you have a truly innovative dementia program. You can come in and identify the levels, but then you can give skill sets to these caregivers so they can better understand how to care for their loved ones. You reduce stress, you increase satisfaction. I can't go on and on. I have witnessed firsthand where you have gone in with our staff members that have been trained through the BOATS program, and it's been transformational in dementia units or memory care units in facilities. When you see the caregivers better understand, how do I interact to get the best out of this person that has a lot to unveil to you if we're allowed to see that person and see who they are and what they are for.
And bringing that hope, not only through that education of the staff, not only are our staff educating families and bringing hope, but the staff has hope because they have a tool and they have an approach and they have a system and they have the education that help them enter into the home with confidence. And so I think that's what set Concierge Home Care apart, is that the staff have that dementia IQ that can, and that they have that hope that they're going to be able to make a difference in the home, wherever home may be.
Exactly. We have 1,600 employees that are touching our patients across the state, providers, doctors as well, because as I mentioned, I'm speaking a lot to the home health benefit, but we also do primary care in the home. And our nurse practitioners and physicians on that side are highly educated from a geriatric perspective and with both dementia and depression, and behavioral health pieces. So every one of our clinical staff members in the first week, we're actually working through some transitions. Their first week of orientation spend several hours in the discussion around dementia and how we care for those patients.
That's a nice segue into talking about mobile medical and that extra value that in-home primary care providers bring to our audience, especially to a person living with dementia who may not be able to easily leave their house. It may trigger them to get into a car or to go to a medical center. So it's so beautiful for Concierge Home Care to have a partnership with a mobile medical group that has the same level of dementia training, the same reference, the same framework. And then not only that, but in 2025, we will be able to bring this new platform that Medicare has created to our audience. Would you like to touch on that?
I will. I'm going to take us back a step too to explain why we have really invested in both the home health, or we call the skilled home health delivery of care, and mobile medical. So many times when you are in a patient's home, you'll be, and I'm going to take from my personal opinion, when I took my mom to my doctor's appointment, she was very good at faking it.
Yes.
And she could fake it for about 5 minutes to 10 minutes, which is the average time you think that a patient gets with their primary care physician. And I would be sitting behind her as she, the physician would ask, are you having any issues with incontinence? Which,
she was.
It's not urinary. And I'm sitting behind her going like this, and she's going, no problems at all. She's lost weight, whatever that might potentially be. They can fake it, and it takes a primary care physician a long time to really uncover that there's issues going on.
Or the right type of caregiver that's willing to look a little bit deeper, because sometimes they never are able to pick up on that.
Well, and my mom would have been really upset if she thought that we were disclosing her difficulties to her primary care doc that way. So for us, having a primary leg of our business has been incredibly beneficial to the way that we care for patients at home, and especially dementia patients. I would like to say we touch about 7,500 patients on a day-to-day basis with primary care in their home, and probably almost half, if not 60% of those patients have some form of dementia or difficulty. So we did apply for a new demonstration project called Guide.
So exciting.
I'm so proud. I'm so proud of our federal government and Medicare to really recognize that dementia care is an area that costs us a lot of money, and we don't do a really good job in the way that we manage these patients, and that there's huge opportunity for how this could be improved. So the Guide program, I always have to reread it, but it stands for Guiding an Improved Dementia Experience. And,
Love it.
And CMS has come up with a model where there's some reimbursement to help.
CMS being Medicare.
Yes, sorry, Medicare, CMS,
Yes.
sorry. Thanks for correcting that. But it is a program where it's going to fund some additional reimbursement to help caregivers and patients manage their care at home or in an assisted living facility or where that might be.
It will be through the primary provider. So the mobile medical group will kind of be the managers, the care managers of this initiative, correct?
It is. There's approximately 200 providers across the state, across all of the U.S. that have been approved, the nation that have been approved for that program. A handful of those providers in Florida of those 200. And you're responsible for a lot of different pieces and incorporated. And we meet on a weekly and biweekly basis with Medicare on the development of what the program looks like, what we're going to get reimbursed for,
and it's really a pilot because Medicare is really trying also to find out, with the help of the providers, on how going into the future, what can dementia care look like. So you're really at the front edge of joining Medicare in this movement to create something that in the future hopefully can become accessible to all providers that choose to do dementia well.
Exactly, and all patients, and outlining. We're creating that roadmap on what this delivery of care is going to look like. It gives them the opportunity to examine all the innovative providers across the country, how they're doing, what are outcomes. They're going to be very tied to multiple layers of outcomes and what that looks like and how we use those dollars.
And really bringing equality to dementia patients. In other words, giving them access to more services that they didn't have before, and also elevating our persons living with dementia with this extra allowance of services, basically saying, you matter, we see you, and we are giving you these services. I think that's another piece of hope that I'm so excited about.
Well, one example in it is, imagine, a family member that's taking care of somebody with end-stage dementia, and they can't get away because if you tried to put your loved one into an ALF or had somebody else come in, it upsets the apple cart so hard that those caregivers aren't getting a break. So respite care is a big part of this, and the fact that Medicare is providing some dollars for family members to be able to have respite care, and we all know vacation and getting away for a moment
it's almost impossible, and it's going to feel that quality of life. Well, Linda, I think Guide is such an important piece of what Concierge Home Care and Mobile Medical is bringing to 2025 that we're definitely going to schedule a follow-up. So please watch out for a full Guide discussion with myself and Linda Murphy explaining to you the benefits and how to access. Because I think that's the most important, is first getting our audience to understand it's available, and number two, what it entails, and then how to access it.
Well, and I would say, but even in the immediacy, I love that. I want folks to understand you have answers today. Yes. In the state of Florida, we provide care across the entire state. We partner with boats. we can come in tomorrow to your family, and it's a benefit that's available to your loved ones and to the caregivers. Let our team come in, use the resources, use the education, use the experts that live this day in and day out to see what they can do to improve the situation and where you're at.
I love that. You have hope right now. You don't have to wait on Guide. Guide will come. Guide is going to get the extra level of support, but right now you have hope. And I would love for you to visit our website, www.boatesmemorymethod.com. That's BOTES. And on our homepage, you will find a link that will take you to Concierge Home Care as our exclusive home care partner. And you can find a branch close to you that serves your area. Linda, thank you so much. This was wonderful. Thank you for joining us. And I'm looking forward to our next discussion where we will unpack the future of Guide.
Well, thank you so much. It's been a privilege to be here.
Thank you so much. Thank you for joining us, and subscribe to our YouTube channel for more. See you later.